Hello, I'm Dr. Tippets. My family and I have been in the Anniston area for 33 years now. The United States Army brought us here, and I worked at Fort McClellan as a orthopedic staff surgeon for 6 years. My primary interest is general orthopedics. We do a lot of knee replacement, we do a lot of knee arthroscopy, shoulder arthroscopy, we do some simple hand procedures like carpal tunnel releases and trigger fingers, and simple fractures, and pretty much anything else that comes our way. We encourage all of our patients to take Tylenol after surgery. They can take 2-3 times a day. Also encourage them to take their favorite anti-inflammatory medication. And oftentimes after outpatient surgery, I will prescribe Toradol, 10 milligrams, and they can take that 4 times a day. And that, along with Tylenol, oftentimes will control the pain. And sometimes we have to go a little bit stronger, but with the Tylenol and the Toradol, many patients are able to have their pain controlled very well. I also encourage the patients, when they're having bigger surgeries like knee replacement and hip replacements, to take the Tylenol, take the anti-inflammatory medicine, and then take the narcotic. But after a few days, they will find that they are taking the narcotic because they're thinking it's going to hurt, and they don't wait until it does hurt. And so we encourage them to take it and then wait until it actually starts to hurt before they take the second dose. And that way they can spread out the time between the dose, and they will find that they will need less and less pain medicine as time goes on. And that's one good strategy to help them to not become dependent on the medicine. 25 years ago, when I started doing the total joint replacements, typically the joints would last about 10 years, and that was due to the fact that the polyethylene spacer would wear out at about 10 years. About 20 years ago, the companies came out with a highly cross-linked polyethylene spacer, and that polyethylene spacer takes about 30 years or more to wear out. So most of the joints are lasting at least 20, and many are going on 30 years, and we expect that all of them will last 30 years or more. So the idea is that your joint replacement will last as long as you do, and hopefully not have to be redone. There is a small chance that someone will have an allergy to the metal or the nickel. Most of our components are made of cobalt, chromium, and stainless steel, and there's a nickel component in there. Maybe one patient in 1,000 will have an allergy to metals, and in that case they will continue to have issues that will require their knee replacement or their hip replacement to be removed. There are some screening tests that can be done if anyone is suspicious that they're allergic to metal. And one of the clinical signs you look for is if they have a watch, and if they get a reaction or a erythema in their skin where the metal touches it, that is a risk factor for maybe being allergic to metal and your knee or hip replacement. So the patient should expect to have some pain afterwards, and as long as they follow the directions that are given post-operatively, 99% of the time the pain is controlled and taken care of. And if the pain is not controlled, that's when you call the doctor about something stronger or something different. I can be reached through rmccares.org, and look forward to spending more time with the good people here in Anniston.